Morning to introduce me to this August gathering, and I'm grateful for the panelists and the chairs to remain seated during the guidelines presentation. And I acknowledge the work of the Aspirin Foundation and and the heavyweights who are sat here. And some of the crowd, I can assure you, is for Aspirin Foundation only. And that is why I have requested you to stay in your chairs, sir. I am going to present first ever guidelines from Pakistan developed by the Guideline Development Forum, Nausea and Vomiting Guideline Forum. I have a disclosure to make. There is a conflict of interest. The Shaigan Pharmaceutical provided us with the resources to arrange the meetings and printing of the material. However, the scientific material and its write-up was completely independent and purely the function of the Guideline Development Group or the Forum. Three groups were initiated, one led by Professor Zeba Aziz, an oncologist, other by Professor Tayyaba Wasim, a renowned gynecologist, and I led the third group, Medical and Miscellaneous group. We were, all three of us were supported by 2 assistant professors in our disciplines. Nausea, the desire to vomit, and vomiting is actually emptying the contents of the stomach through your mouth. According to a prevalence study, an epidemiological study conducted in 2010 in United States of America, a person in 1 year, any person, 50% of the population can have one-time feeling of nausea, and 30% can actually vomit. We were very surprised to see this figure, and but this is pretty high in my personal experience. 80% of pregnant women, they experience nausea and vomiting during the first trimester, and 90% of those who receive emetogenic drugs, highly emetogenic drugs, do get nausea and vomiting, and sometimes it can be fatal. We in these guidelines looked at 4 different types of etiological groups: nausea and vomiting of pregnancy, post-operative nausea and vomiting, CINV, cancer and chemotherapy-induced nausea and vomiting, and medical and miscellaneous group. Where is the center of vomiting? It is in the 4th ventricle. It is in the medulla oblongata, in the floor of the 4th ventricle, in a place called nucleus tractus solitarius, and the area post rima, where it is situated, along with chemoreceptor trigger zone, both of which are outside the blood-brain barrier, and that is why those drugs which do not cross the blood-brain barrier can actually help in controlling nausea and vomiting. Then this center also receives stimuli from stomach and vagus nerve, and also from the cerebellum and vestibular signals and cerebral cortex. And this is very significant, cerebral cortex. Any stress can cause nausea and vomiting. So when we diagnose, we need every patient in coming to you, whether he is in which group, nausea and vomiting of pregnancy. It's not always easy to diagnose that, and you have to do certain tests in a young female. Post-operative nausea and vomiting, CINV, cancer and chemotherapy-induced, and medical and miscellaneous group. First thing first, what to do first? Take a history. This is extremely important, and the physical examination. So this is the main thing. Clinical encounter with the patient. This is clinical medicine, and this is what Pakistan Society of Internal Medicine stands for restoring the pride of clinical medicine, not only internal medicine, clinical medicine. It comprises of three things: history, physical examination, and the third, कल भी कई लोग बात कर रहे थे कि आपने रिफ्लेक्स डॉक्टर नहीं बनना. Professor Ejaz Vora baat kar rahe the in the fellowship award ceremony that we want you to be thinking doctors. The third pillar of clinical medicine is clinical decision making, analysis. Reflexly nahi chalna. And that is what we do most of the times. So for history, listen to the patient. A very difficult art for some people. Ask her to elaborate his or her symptoms. Half of the bimari is gone when the patient has this faith in her or him that my problem has been listened to and understood. Do the diagnostic basic workup, and it also help you assess not only the cause, and we have published these guidelines, they are available with you and they are up now, and this is always a living document. Your input will make us improve it further. So these will not only help us make the diagnosis but also assess the severity. CBC, electrolytes, liver function tests. Many a times, patients who are not jaundiced come with nausea and vomiting in my clinical practice, and I don't do practice as a gastroenterologist only. I am a family physician for many patients, and I do liver function tests, and I am surprised that they are altered extensively, no obvious jaundice. Renal function test. We have had surprises of having chronic kidney disease in young, otherwise asymptomatic, just having non-specific symptoms. Pancreatic enzyme also gives, so these are the basic tests and mentioned in the guidelines. And a pregnancy test, sometimes the woman does not know, the girl does not know, and is actually pregnant. And I have had this in my experience, that I have tested unmarried ladies, and they never gave up this history that they had any sexual intercourse and they were pregnant and having nausea. So, and when I asked my residents कि भाई ये भी करवाना चाहिए था, तो वो कहते हैं कि तो married ही नहीं है. So even without marriage, you can expect a child. So what test is meant for what? After the basic diagnostic workup, mechanical obstruction के लिए imaging करनी है. Start with a plain X-ray abdomen erect position. Other day I received a call from Aftab. One of my family friends were there because their son is posted there. तो उन्होंने कहा ये हो गया. मैंने कहा पहले ये एक्सरे कराएं. And that lady had typical intestinal obstruction, और वो 2 दिन से उस तकलीफ से गुजर रही थी. अगर आपको म्यूकोजल इंजरी जेन में है तो फिर आपको एंडोस्कोपी करनी पड़ेगी. कैप्सूल एंडोस्कोपी इज बियॉन्ड द स्कोप ऑफ आवर पॉपुलेशन. जैसे अभी शहबाज कुरैशी साहब ने कहा कि स्ट्रेप्टोकाइनेज और एस्प्रिन इज अ पुअर मैन स्टैटिन, टू विच आई कंप्लीटली डिसएग्री. Statin is a statin and cannot be replaced by anything. Whether the man is poor or rich or not rich, must receive a statin. Must. And when you feel as a physician, जैसे कि अब्दुल समद साहब ने कहा कि अगर मैं कहूँगा तो मेरा मरीज तो लेगा, अगर कुरैशी साहब आप भी कहेंगे तो आपका मरीज तो लेगा. तो आपके कहने में इतना असर है, मगर आप ही अगर डाउट करेंगे तो फिर ये नहीं हो सकेगा. For gastroparesis, you need gastric emptying studies, and for diagnostic workup of functional nausea and vomiting, you need Rome 4 criteria. Then there are infections, GI infections, infections outside the GI tract. Many patients with UTI get nausea and vomiting, and then food poisoning, motion sickness, alcohol and toxins. सर ने बात की कि यंग लोगों में एमआई हो रहा है. हम देखते हैं यंग लोगों में एमआई हो रहा है और स्ट्रोक हो रहा है. एंड डोंट अंडर एस्टिमेट द यूज ऑफ amphetamines and methyl amphetamines. They are rampant in certain parts of Lahore, in the university students, in hostels of our institutions, and young people are dying and we are not even considering it. Take history, ask the patient. Sometimes they are unconscious, ask their friends. It takes a lot of effort, a lot of patience to think of toxins. आप सोचेंगे, आप निकाल लेंगे. Inflammation, acid peptic disease, this is all in the guidelines. And psychiatric disorders, very common. And I tell you, sir, ladies and gentlemen, most of the people with nausea and vomiting may have a comorbidity. एक ग्रेट फिजिशियन मैं कहता हूं वो है जो ऑब्वियस कॉज के साथ एक और कॉज भी तलाश करे. एक प्रेग्नेंट लेडी में साइकोलॉजिकल प्रॉब्लम भी देखे. एक लिवर कैंसर के पेशेंट में वॉमिटिंग के साथ ब्रेन मेट्स का भी सोचे. प्लीज थिंक ऑफ अ कोमॉर्बिड कंडीशन complicating your patient, and just your thinking, your clinical decision making, your analysis can change the life of the patient. और behavioral change, मैंने ये देखा है कि पहले ज़माने में लोग बताते नहीं थे. मैं मरीज देखता हूँ, I see many patients who need change in their behavior, they are anxious. तो behavioral change, वो जब आप मरीज को बता देते हैं कि हमारे ख्याल में आपका ये nausea and vomiting is being complicated by stress also, तो patient भी फिर are more willing to listen to you. And sometimes patient will require rehydration, especially if the patient is on chemotherapeutic drugs. And I tell you, as I mentioned earlier, chemotherapy, radiotherapy can actually cause death because of nausea and vomiting. और आपको preemptive treatment करनी है. और जब ज़ेबा अजीज साहिबा से हमारे ये सेशंस चल रहे थे तो उन्होंने कहा कि ये डेथ तब ज़्यादा होती है जब मरीज सरकार के हॉस्पिटल में होते हैं, क्योंकि वहाँ रिएक्टिव इलाज होता है. वहाँ पे रिएक्शन, अगले दिन जब हुकूमत गिर रही थी तो सब कह रहे थे अब ये रिएक्टिव मोड में चले गए हैं. एक कुछ फैसला लेता है, दूसरा उसके रिएक्ट करता है. एक ये करता है, वो प्रिजन वैन भेज देते हैं. एक ये करता है, वो सुप्रीम कोर्ट खोल देते हैं. सो दैट इज नॉट अ गुड टाइप ऑफ मैनेजमेंट. सो यू हैव टू बी प्रीएम्प्टिव. देन देयर आर नॉन फार्माकोलॉजिकल ऑप्शंस. नींबू निचोड़ के पुदीने का कावा पिए, नींबू निचोड़ के अदरक का कावा पिए. And it is mentioned in many guidelines of Britain and US that you use ginger and peppermint and lemon. And then there are pharmacological options. Don't underestimate the importance of yourself, the physician. Time magazine said that every person, every patient also needs the dose of the doctor. And I am a strong believer of this. अगर आपने अच्छी तरह उसकी बात सुन ली, and ईस्ट मोहम्मद साहब is a strong advocate of that, तो आधी मरीज की मर्ज वहीं खत्म हो जाती है. And then don't underestimate the use of pudina and ginger and lemon in the diet. And then come the pharmacological intervention. 5-HT3 receptor antagonist on Densatron. I have seen wonderful results with the loading dose. Problem क्या है loading dose के साथ? It can rarely, I repeat rarely, cause QT interval prolongation, and sometimes arrhythmia. So you cannot go beyond this. अगर तो ओरल लोडिंग डोज है तो 3 गोली, अगर आईवी लोडिंग डोज है तो 2 टीके 100 ml नॉर्मल सलाइन में डाल के आपने आधे घंटे में या 20 मिनट में दे देने. No issues at all. Then our H1 receptor antagonist, tablet vitamin B6 and doxylamine for nausea and vomiting of pregnancy, cyclizine and dimenhydrinate, phenothiazine derivatives, chlorpromazine, these are all in the guidelines which are. Then pro-motility drugs, metoclopramide, domperidone, itopride, and levosulpride. Dopamine cannot, and dopamine antagonist cannot cross the blood-brain barrier, but since I told you earlier, and I reiterate, that chemoreceptor trigger zone and nausea and vomiting center lie outside the blood-brain barrier. Levosulpride is not only a dopamine antagonist, but is also a 5-HT receptor agonist, and it has also effect on gastric emptying. Now, this is extremely important. Corticosteroids. I'm coming towards the end of my presentation. हालांकि मेरे पास 30 minutes है, according to the time published. हुक्म मिला शौकत जावेद भाई से कि 20 मिनट में कंक्लूड करना है. अभी 3 मिनट और अब 35 सेकंड रहते हैं मेरे पास, तो आई डू दैट जस्टिस सर. इन अ रिफ्रैक्टरी केस, चाहे वो नॉजिया एंड वॉमिटिंग ऑफ प्रेगनेंसी है, चाहे वो हाईली एमेटोजेनिक ड्रग की वजह से है, चाहे वो किसी और स्वेयर इलनेस की वजह से है जो रिस्पॉन्ड नहीं कर रहा, immediate response for the consumption of family physicians especially, a dose of corticosteroids in pregnancy can remarkably improve nausea and vomiting of pregnancy. 100 milligram twice a day for 2 days and changes the life of the patient. मैंने घरों में जाके देखा है कि बच्चियां इतनी वो परेशान होती हैं इस वजह से. एक्सक्यूज मी काशिफ साहब, मैं आपसे दरख्वास्त करूंगा हाथ बांधकर कि अगर मुझे खत्म करने का मौका दिया जाए. अच्छा जी, फिर सारे ले आए जी, मैं रुक जाता हूं. ले आए. जावेद साहब की इंस्ट्रक्शंस इसलिए थी कि आपने मुझे बाईपास किया है. मैंने आपके साहब यहाँ पे उनको कहा था कि मेरी टॉक के बाद कीजिएगा, मगर आपने यू ट्राई टू बाईपास मी बाय आस्किंग जावेद अकरम साहब. जावेद अकरम साहब के लिए तो हम लेक्चर खत्म कर देते. आपकी इजाजत से शौकत अली जावेद साहब, थैंक यू. आखिरी 2 स्लाइडें थी, हिम्मत रखें. शिफ्ट टू टैबलेट प्रेडनिसोलोन एंड 2 ड्रग्स, olanzapine and lorazepam. ये दोनों ड्रग्स हैं विच कैन डू वंडर्स. कोमॉर्बिडिटी की मैंने बात की है, एंड दिस इज ऑल्सो इन द गाइडलाइन दैट व्हेन द पेशेंट इज नॉट गेटिंग बेटर, व्हेन द पेशेंट इज नॉट इंप्रूविंग, यू थिंक ऑफ अ कोमॉर्बिडिटी. स्ट्रेस चल रहा होता है, एंजाइटी चल रही होती है, and if you use, and these have antiemetic effect of their own also, the patients can really respond. So those who do not respond, think of using corticosteroids, olanzapine and lorazepam, and you can get the desired result for your patient. When you are not getting the desired result, think of comorbidity. And this is my last slide. Thank you, sir. I invite you to Lahore next year, and please be there for the 4th annual International Conference of Pakistan Society of Internal Medicine. It will take place in March next year and my brother from KPK is also here. My friends from all over Pakistan are here. Amir Ghafoor Saab, and I was so pleased and delighted to meet Professor Shahriyar Sheikh last evening, and मैंने रात उसके बाद भी जावेद अकरम साहब से कहा कि सर को नेक्स्ट भी हम बुलाएंगे, एंड आई होप ही विल कम. अब्दुल समद साहब को भी बुलाएंगे. अगली कॉन्फ्रेंस में भी हम एस्प्रिन फाउंडेशन की बात करेंगे. एंड सो शौकत जावेद साहब, पुट दिस डेट इन योर कैलेंडर सर, एंड मैंने 20 मिनट में आपका काम तमाम कर दिया.